Soccer games, violin recitals, and bike rides in the hills of Tennessee are activities all 4 of my children had in common the first 10 years of their childhood. Now, engineering and nursing define 3 of them, but my 3rd child, Rebekah Lynn Haynes, age 22, is defined by her life expectancy. I am Rebekah's mom, Mary. Thank you so much for taking the time to listen to her story. From the age of 5 to 15, Rebekah went to 14 doctors in 4 states to get a diagnosis for Niemann-Pick Type C. While frustrating that it took 10 years to get a diagnosis, the delayed diagnosis has most likely not made a huge difference in her outcome, as there continues to be no approved treatments for NPC. Yet we have done our best to manage the NPC symptoms as they presented in Rebekah. At diagnosis, Rebekah, age 15, was able to navigate the stairs to her bedroom. The following year, the dreaded grand mal seizure started. She kept asking, "What is wrong with me?" and I could not find the words. Over the next year and a half, uncontrolled seizures and multiple medications changed her life drastically. My sweet 16-year-old daughter started wearing diapers, using a walker, and lost much of her ability to speak and swallow. At 17, Rebekah had a feeding tube placed, and with a ketogenic diet and proper medications, we were able to obtain seizure control, but much damage had already been done. For several years during this period, Rebekah was in occupational speech and physical therapy. She also participated in aquatic and equestrian therapy and buddy baseball. Despite our best attempts to manage her symptoms and keep her active, Rebekah has continued to decline. 7 years after diagnosis, I have put my career as a registered nurse on hold to provide 24/7 care for Rebekah. Rebekah is unable to participate in many activities. Her inability to follow commands and non-existent fine motor skills does not make her a good candidate. Rebekah now has a tilt and space wheelchair, and after 3 hospital stays with pneumonia, Rebekah's lungs are her most constant struggle. The vest, suctioning, cough assist, oxygen, and oxygen monitor are necessary to keep her out of the hospital. Her pulmonologist has given her inhalers, nebulizers, and nasal sprays to use as needed. The doctor calls them tools in her arsenal. I am grateful to have these choices. Choices is something parents do not have when it comes to approved disease-altering therapies for NPC. I would love to have choices or tools in Rebekah's arsenal to treat Niemann-Pick Type C. At Rebekah's stage, we are constantly weighing the pros and cons of any stage and are fortunate that currently she does not require any daily prescription medications. Even so, we have been participating in an experimental treatment over the last 4 years. After treatment, we see small improvements for 3 to 4 days, a small smile, a few words, an attempt to wipe her own nose, the ability to hold her head up a little better, or just a little improvement in muscle control is what makes this 5-hour drive worthwhile. Finally, as a parent, how do I wish Rebekah's journey had gone differently? I wish she had been diagnosed at birth. I wish that diagnosis had made a difference. I wish she could have had tools in her arsenal or choices to combat this disease. As we are hearing today, from infant diagnosis to adult diagnosis, slow progression to rapid progression, with the diversity of all the different symptoms and journeys of this awful disease, it is doubtful that all medications will be useful for all. I wish simply to have medication choices available to make informed decisions for my child on the treatment of Niemann-Pick Type C, as well as medications for the management of the symptoms this disease causes. Thank you for your time.